warmly welcome to the Joint Action Prevent NCD webinar on the role of sustainability in shaping health futures. We have 4 speakers today. We will try to share with you how the sustainability work is organized, is framed in Joint Action Prevent NCD. If we go to the agenda for today, we will do a short introduction. Then we will say something on the accountability cycle, something on the youth engagement, and some reflections from our external expert advisory board perspective. The Joint Action Prevent NCD, it's on preventing non-communicable diseases. It's really a unique collaborative effort with highly ambitious goals, if we can say. We would like to reduce the burden of cancer, or to add to the reducing the burden of cancer and other NCDs, and also their common risk factors. We could say that this is the largest EU joint action ever. EU has allocated a substantial 20% of its overall health budget into this action. The project will be from January 24 till December 27. The project lead is Norway, and we have practically majority of the EU countries and some of the EFTA in the partnership, 25, with 106 partners involved and almost 100 million euros budget. We have also 10 associated partners, so it's really a huge consortium. If we can go now next, it's I would like to speak about the role of the sustainability in the Joint Action Prevent NCD. Why do we speak about the sustainability? Because if we want to really reduce the burden of disease and to improve the quality of life of populations, which is the main task of this joint action, then any successful project in this area must be sustained over a long term. If we just work till the project ends, we do not get far. And because the main objective of this joint action is that we would like to understand sustainability elements of the actions, and we would like to recommend actions to the national players, to the European Commission, and also to the Council of EU. How do we approach the sustainability actions? If we ask ourselves, the main aim of our work is that we specify sustainability objectives like threefold. We would like to collect sustainability elements, and I will be speaking more about that through my part in the introduction. We would also like to inform and raise awareness among the decision makers how the sustainability is important, why it's important, and also we would like to identify jointly with the consortium the windows of opportunity, because we would really like to see that actions we are trying to implement, we are piloting the implementation, would also be alive and be implemented after the joint action ends. If we now ask ourselves, what is the definition of sustainability for our joint action? We can say that the sustainability indicates the ability to maintain components and activities over a long term. So whatever we will be trying to do in our joint action in different areas, it means in policies, in local environments, in the context of equity, monitoring, also policies and specific approaches in cancer prevention, we would like to see those activities being implemented in a way that they would survive the termination of the project. Sustainability is also a dynamic process, which is allowing to adjustments, improvements, learning and developments. And that's changing in line with the needs of the system, so that we also understand what is needed, how it is needed, where could it be embedded, and then the issues we are working with will be far more sustainable. And also sustainable planning is important, so we would like to recommend in this area too, in the final recommendations in 2027. We are working with 5 aspects because speaking about the Prisma search we've done before entering this action, we noticed that majority of the speech about sustainability goes to the environment and health, not that much into the projects and actions. So for us, trying to understand the sustainability of projects and actions, we are working with the 5 aspects. One is time. So we would like to see any action to be long-term in the maintenance. We would like to see the continuation of project actions, elements, and components. We would like to see also the positive impacts and effects to be continued after the project ends. We would like to see the behavioral changes and also evolution in the action so that we enable also for that. If we go after the definition into the sustainability factors, we also are here quoting to the Prisma search, which we've done before entering into that. We can group them into 3 folds. One are factors about the internal context of a public health action. Then it's really very important how what is the organizational capacity for the implementation, and also the factors about wider external context. And if we believe in what is already published, what people have already found in this area, the most often affecting the sustainability are the following factors: the stakeholder integration, staff, and financial capacities. So 2 from the capacities and 1 in the stakeholder integration. If we look now into the approach, how do we want to understand the sustainability in Joint Action Prevent NCD? We would like to link the policy cycle, accountability cycle, and theory of change. And at the moment, in year 1 and year 2 of the project, we are trying to explore and best possible employ those 3 concepts. With the public policy making, we are taking into account the setting of the agenda, then alternatives for the different actions, then the choices made about those alternatives, and then the implementation of the decision. That is a typical cycle. And on that cycle, we would like to put the accountability cycle, and our next speaker will go in depth into that part. And then we try to understand what would make the change, that the things would really happen, because we have quite a number of experiences that we are developing something. We understand how it should be implemented, but then nothing happens. We cannot make a push. Belgian presidency has shown so nicely that there are a number of public policies, but they are somehow stuck in any of the steps, or maybe just entering into the implementation. So we would also like to employ a theory of change models, so that we would be describing how change is expected to happen, or if it has already happened, because it's also useful to use this models in designing interventions or assessing the designs of the interventions with the support of theory of change models. But let's see how far do we come in this respect. Regarding the sustainability elements, I have been speaking through all of the introduction about them. There are a number of them. We will be exploring all of the actions in joint action regarding those elements, and would also like to understand how they fit into the specific steps of the accountability cycle or accountability framework. And Gabriela will be speaking about that in a minute. But if you want to learn more about that, you can always follow us or get additional information if you contact us in this regard. But let's now look into that, how our work how our sustainability work in joint action looks like. So we would like to, from the top down, build on what is already known in EU space about the sustainability of joint actions. We would like to work with the specific stakeholder groups from the Commission and also health attachés, but also organized youth. We would like to employ the accountability cycle for the policies and practices, and also it's one of the main goals is the establishment of a body European Consortium on Cancer Prevention. Everything would be embedded in the well-being economy principles because we believe that that would be the best way forward. And please, if you haven't done that yet, look into our previous webinar on well-being economy because it's really an excellent one. And at the end, we will come up with the recommendations. But our presentation from here on will be touching 3 of those actions which we have. One is on the accountability cycle. That will be Gabriele. And then Katja will speak more about the national and EU level organized youth in our joint action. And then we have also the third speaker now with the recommendations. And we are here really looking very much forward to our external expert advisory board. And here we will have their comments. So if we go now to the next speaker, which is Gabriele Citecat. She's a researcher at Cienzano's Cancer Center in the Implementation Monitoring and Evaluation team. Her current work focuses on coordinating the developing of a Belgian cancer inventory, the new monitoring framework for cancer care and control policies for Belgium. So it's really interesting to follow that developments. She's also working on ensuring the sustainable uptake and implementation of pilots in public health policy for the Joint Action Prevent NCD, as well as strengthening the prevention continuum in cancer screening in the Joint Action EU Can Screen. She has a background, and that's why she will be so greatly speaking about the accountability cycle in sociology and public health. And she has a keen interest in leveraging behavior insights from more effective public health policies. So please, Gabriele, the word is yours.
Thanks so much, Mojca. Let me just share my screen. Great. And thank you for everyone who's here today. I think you can all see my screen. Yes, great. Thank you, Katja, for the confirmation. So as Mojca said, I'll be speaking a bit more about the role of accountability in our sustainability approach and try to take a social and a more political lens when we look at this. I think, though, as Mojca said, this is a massive joint action, bringing together almost all European member states as well as those in the EEA. And I think when we think about sustainability, and it's really, as Mojca said, where we want to go and if this can continue into the future, it's good to have our eye on something. And together, when we discussed where we wanted to be at the end of the joint action in December 2027, we had 4 points. So first, that there was a plan for the sustainable implementation of the good practices and policies identified through the joint action, that member states were aware and engaged in the role in the sustainability plan, that there was support of the EU Commission to do so, and that we use a new body currently called the European Consortium on Cancer Prevention, to be seen if that stays as a name, to strengthen the accountability cycle. And actually, all these elements are things that are related to the accountability cycle that I'll be speaking about shortly. But before we launch into the accountability cycle, I think it's best to put a definition on things that we speak about. And accountability is certainly a word we hear very often, both within our private lives, within the lives we have within our social groups, as well as in possibly research or different initiatives. So I think it's a good perspective to consider accountability as quite diverse. It's not just one thing. Indeed, we often think of accountability as of who is accountable to who and who are they accountable to. But there are quite a few dimensions. We can consider a provider dimension. So essentially a healthcare provider in some cases towards their patient, organizational, whether that's internal to the organization or from one organization to another. Political, so whether policy or decision makers to citizens, or social, accountability, responsibilities that we have towards one another within groups. And I think it's beyond this various dimensions, we can consider directions as well. So downward, people above, for example, policymakers or politicians, and their accountability downwards towards, say, citizens as a group. Horizontal, so different organizations to one another. We could say Cienciano's Cancer Center is accountable in some way to the National Institute of Public Health in Slovenia because of our work together. Or we can think of vertically, so the opposite of downwards. And I think it's important to consider it's not just the people who are accountable and who they're accountable to, and that this is done through, say, speaking to say, like, well, you've told me what you're doing and how you're doing it, so that's fine. It's also about having a dialogue around this to be able to share what is happening, why it's happening, and create moments of questioning. And this comes to a point we'll talk about in the accountability cycle about holding people to account. And for us, that's, of course, decision makers at various levels in the EU, from supranational, the EU, to national, to local level. So now that we have a bit of a definition of the diversity of accountability, I want to introduce you to the cycle that we'll be using within our sustainability plan. So this is a cycle proposed by CAC, and we can start with the idea of taking the account. So it's a cycle, it continues, but taking the account is where we'll start in sort of this chicken and egg cycle. And this is essentially what we're doing in the joint action. All our colleagues who are assessing policies, running pilots to identify good and best practices, they're generating the evidence we need to understand what's happening as it is now. Once that is established, we have to think about the sharing of the account. So, of course, if we want, say, policymakers to be accountable to citizens, to members of the joint action, they need to know the evidence to be able to make decisions, to be able to, say, respond. And that's the sharing. And this is the communication aspect of accountability, the dialogue, essentially, between stakeholders. Then comes the holding to the account. And that's really the empowerment of stakeholders, decision makers, citizens, different national institutes, et cetera, to take action. And that can be based on, say, putting a certain practice or policy on the agenda. It can be to implement certain initiatives, but that's really the holding to the account. And then the final part of this cycle, before it goes back to take the account, is to respond to the account. And that's really when we analyze, okay, is the holding actually responding to the taking? Are we meeting the gaps that are identified, or are we meeting the goals that we set? And here I think what's important is essentially, if we want to arrive, what Moisha said, is we want to ensure that in 4 years, all these activities and the good practice we learn are going to continue after the joint action. We then need to consider the evidence that's being generated, so the taking of the account, who and how to communicate with, our sharing of the account, the different policy structures that will influence the uptake and how these people can implement the what has been shared, and that's the holding to the account, and to monitor this. So essentially, when we think about the sustainability plans, different elements of the joint action will go into this. And in our work in the sustainability plan, we'll really focus on both the sharing, and Katja will speak a bit about this, the sharing towards, say, youth and their involvement, the holding, so how people can implement this, and then to design how we could possibly evaluate if this is functioning. That seems very nice and seems like a good plan, but of course, as often there are gaps in ensuring this cycle is, say, leveraged. And the first I want to speak about is knowledge translation and its impact on sustainability. So essentially, we have a gap that's quite well known called the science to policy gap. And essentially, this is not that we don't have the right evidence or the science to back up where we want policies to go, but it's not necessarily converging. Ideally, knowledge translation happens, and that is when we have our science moving to the policy. So knowledge converging with action. So this is really this part from the cycle, from the taking to the holding to account. Unfortunately, some of these gaps, if we are aware, can be overcome. If we look maybe on the researcher side or the scientist side, sometimes we're not aware of, say, what is being discussed at the political level, and the research doesn't hit the mark of what politicians are discussing, so it's dismissed. There's often ineffective communication, so on that sharing the account, perhaps it's not shared in the right way to the right people or with the right communication methods. On the scientist side, we may poorly understand, say, policies ongoing in cycles, so not know where we can, say, leverage the holding to the account. Or we focus and link to ineffective communication too little on the public's understanding of science and the outputs from our research. That being said, it's not just on the scientist side, it's also on the political side or the decision maker side. And sometimes they just don't have enough time to go through all the research, which is important to consider when we're talking about sharing the account. They're ignorant of what's going on, or they have a lack of access to this knowledge. So the idea of being aware of these gaps to knowledge translation is that in the sharing to the account and the holding to the account, we can tackle these, and we will be trying to fill in these gaps essentially within the sustainability plan. Accountability, though, is quite related to the policy cycle. And why is this? Well, if we want to essentially share and then hold to account, we need to ensure we know where there may be opportunities to hold to account. And as we saw in sort of this knowledge translation gap, often it's because scientists, we're not really sure what is on the agenda, what discussions are ongoing. And so it's super important that we're aware of that to be able to use this accountability cycle and sort of guarantee the sustainability of the outputs of the joint action. So for those that may not know, in a very simplistic way, the policy cycle goes from agenda setting, so what is going to be discussed on the agenda, the discussion of what this policy will be, it's for formation, acceptance, if that happens, what means need to go into that for it to be then implemented and then evaluated, essentially. And that seems very nice, but of course we know that policymaking is a lot more hectic than that. Despite that, it's quite important to understand where we are in the policy cycle for all the different topics that the joint action is dealing with, whether that's physical activity, tobacco use, the well-being economy, to see where that evidence we're generating can then be communicated and where it can fit into the holding to the account, so how this can be implemented. And essentially, this understanding of the context around the policy cycle, the actors, where it's at, what is being discussed, will be essential to implement that. Before I pass it off to the next speaker, just to summarize, why are we discussing accountability when we speak about sustainability? It's because of the potential it has to sort of underpin the success of the sustainability plan. As I mentioned, the taking of the account in this accountability cycle is there are scientific studies, our review is what is known, what good practices are we generating as a project team within the joint action. And so the gaps may not be there in this taking of the account and the generation of evidence, but it certainly often is in how we're communicating this, so the science to policy gap for knowledge translation, and how we're ensuring that decision makers are held to account. Because it's great to generate the evidence, but how, as Moishe said, do we ensure this is taken up and implemented? So it's essential we consider accountability and put in accountability mechanisms then at the right place. And that's the interaction with the policy cycle, putting in mechanisms at the right place and the right time related to the right subject. So moving forward, essentially, the next several years, we're going to use both the accountability cycle, policy analysis, and the mapping of good practices to strengthen our sustainability approach. So thank you. I will stop sharing and hand it back over to Katja.
Gabriela, thank you so much, really, for this excellent presentation. I think that it's so clear when you speak about the accountability cycle that we have to know it. We have to know who is accountable for what if we want to achieve whatever in any of the policy action or practice. So thank you so much for sharing your wisdom in this area. But now, as you already have said, we have Katja with us. She's taking care of the youth engagement for sustainability. So she will be touching more, as you has also introduced, how do we share the account with the stakeholders groups, what they can understand. Katja Cic is currently working as a project associate at our Slovene National Institute of Public Health, where she coordinates the Joint Action Prevent NCD Youth Advisory Group. and she acts as the coordinator also of EHP Partnership on Youth, and she's also on the WHO Youth Council, where she chairs the working group on planetary health. So I think, Katja, that you are more than appropriate for this presentation. Please, the word is yours.
Thank you so much, Mojca, as well as Gabrielle, for giving us the intro to the sustainability and just giving a very strong base on which we can then build on. So without further ado, a lot of our work in Work Package 4 is about expanding youth engagement to different levels to really make sure that we move from quantity to quality, especially with what Gabrielle mentioned in including youth in all phases of the accountability cycle in order to really make sure that the presence is there and that young people are recognized as experts of their own realities with concrete experience of what is it like being young right now, especially because we are living in a rapidly evolving, highly digitalized, fast-paced world, and youth can be considered as change agents, making a difference by addressing needs and tackling issues that matter the most to them. So using this backdrop of, increased political polarization, climate crisis, rise of populist movements, and so on, all of that really disproportionately affected children and young people. So we found it necessary that we need to find ways to elevate young people's access to spaces of influence. And the way how we went about it is that we actually based our strategies on several frameworks that historically characterized what makes engagement of youth truly meaningful. And that stems everything from the EU Youth Strategy, Roger Hart's Ladder of Participation, and what you can see on the screen, which is the Lundy model of participation, which actually helped provide a pathway to conceptualize Article 12 when it comes to the United Nations Convention on the Rights of the Child. And with this growth of the youth rights movement, this also increased the recognition of young people's ability to express their own views as well as speak for themselves. However, their voices are often still not given due weight or are just used in an exploitative or frivolous manner. And this is something that we don't want to do in the joint action. So we used all of these frameworks to inform our way of working with youth to really ensure that we're working with them in an inclusive, mutually beneficial partnership in order to really help us generate relevant, reality-checked, and responsive actions, as well as opportunities for intergenerational dialogue at all levels of our work. So they will be used in all parts of the project within different work packages, especially advising to the coordinators of the project. So we also recognize that there is a critical difference between what is considered meaningful and what is considered tokenistic youth engagement. And tokenism can have negative impacts on young people as well as how they can be involved. So we decided to really just focus on the 4 degrees of meaningful youth engagement, where youth is involved in a meaningful way, whether that is from being consulted all the way up to where youth can actually initiate actions and lead them as equal partners. So we want to, model, standardize, and systematize this meaningful engagement within the project in order to really help understand, elevate, and respond to the lived experience of young people today. Because again, they are a generation who is affected by the environments, the policies that affect NCDs in the long run. And we also want to partner with them to build institutional anticipatory capacity and really proactively address emerging issues, future disruptions, and everything that could impact their generation in the future. So how are we going to even go about doing that? Because again, there is a clear gap between the space young people are given in public life and their level of interest and engagement. So we know that there's evidence showing that it is beneficial to engage youth in all phases of the program cycle, as well as include them in how resources are invested in the way that will affect them and the environments they live in. So we will establish, as was mentioned before, the Youth Advisory Group. We will communicate through this Youth Advisory Group with a broader youth chapter that will contain a number of interested youth across Europe that wants to help in prevention of NCDs. And we will also build internal capacity within the informal young professionals network, because we realized that within our project, we already have a very high amount of young people actually working on the joint action, but we didn't have a tool for how to get them to connect. So we will be engaging them in order to, hopefully get improved impact, increased agency, retention, sustainability, and of course, ensure that the validity of data collected through the project and the improved responses will actually recognize and meet the needs of young people. So as I was saying, we will be involving them in all parts of the project cycle. So that overlaps a lot with the sustainability concept that Mojca presented and the accountability cycle by Gabrielle. So several degrees of this youth engagement will be explored, from the consulting, contributing, partnership, and leading initiatives. And for many purposes, we will also be using their advice on the strategic level to really, shape the initiative to make sure that the response is there. We will then also be utilizing the planning and co-creation aspects to involve young people in education and training, help us create knowledge, provide services, especially raise awareness and mobilize communities that they are a part of, but then also provide them with opportunities for networking and partnerships, because we understand that in the long run, that will make a huge difference to them as well. And a vital part of the process is also to ensure that young people are properly informed. So they will be a part of the implementation level as well, where they will have a space to speak out about their own agendas. And together with them, we will be able to consider the context, the power relations, the struggle for equality, in order to ensure that during implementation, we can support access to youth-friendly information, meaningful decision-making mechanisms, and integrated accountability structures that contribute to our sustainability focus. Last but not least, of course, they will be involved in the evaluation as well, because this data will help us kind of move forward, monitor the responses, and see how we can also improve in the long run. In terms of the benefits of youth engagement for sustainability, of course, there are many, and most often people think of the individual level benefits. And while, yes, there are a lot of positive returns of meaningful youth engagement that are far-reaching and multi-layered, so young people who find these ongoing opportunities to engage in our programs will actually realize personal growth, long-term benefits, and we will be able to give voice to potentially vulnerable communities that are silenced in normal scenarios. But we also have to consider the impact on sustainability on the systemic level, because building these healthy and intergenerational working relationships can actually help us narrow the empathy gap between those that remain in power and the lived experience of children and young people, while this promotes intergenerational justice as well as long-term thinking in policy making. And this proactive action from adult allies and power brokers is really key to ensuring social change by including youth, so that voices can be heard, not ignored. And we need the underlying power structures to be changed there. And we can act by providing a really good example on this, to leverage the youth engagement as a subtype of social participation, and to really make sure that we can enhance the project's impact, longevity, adaptability, and really enhance the sustainability by fostering these long-term community engagement and ownership. So the systemic benefits actually don't end there. I compiled quite a few more. And all of them kind of bring together to this final conclusive thought, where youth should be seen as a driving force, as a positive and constructive social change agents who use social mobilization in order to drive better health outcomes and help us translate our different goals into implementation at national level, subnational level, and also local level through a variety of their engagement at these levels in their communities, and help us translate these policies both from top to bottom and bottom-up approach so that we can meet in the middle and really have a dialogue between both of these levels. So to conclude, in terms of the sustainability aspects, youth are really key to identifying new solutions that secure breakthroughs that our world really urgently needs. And together, we can really create real impact. So while we know that when it comes to participation in public policy making and decision making, we are seeing a lot of good initiatives. Youth often still remain almost invisible on the decision making platform. And mechanisms such as youth parliaments or youth councils often struggle to make an impact on the decisions that are actually being taken at the content table. So we want this to be translated differently into our multilateral sphere and to kind of go from this patchwork of youth engagement opportunities that we have now into something that is more continuous, more sustainable, and provides a little more influence to youth over the decision-making processes. Because at the end of the day, youth is the world is currently home to more than half of world's population that is actually under 30. However, interestingly enough, we have only less than 2% of parliamentarians worldwide within this age group. So by having youth really engaged meaningfully, we can ensure that their voices are represented in these decision-making spaces. And through our commitments, we can provide them a strong platform to create this impact that we have been talking about together with us as equal partners. Thank you.
Thank you, Katja, so much. I think that you are assuring us that this project will definitely work on the sustainability. If nothing more, it will be strongly observed and advised by the Youth Advisory Board. So no doubt that we will go into this direction. Thank you so much. And what we can also say that Slovenia was quite strong in co-hosting the social participation resolution, which was adopted at the General Assembly of WHO in May this year. And in fact, the social participation here is so nicely also adding to what you are describing, how the youth cannot just follow being engaged and follow the work, but being in the core of any action which we will try to implement. And I'm sure that you will be working on that. But here we have our last speaker, because I think it's the right role to speak from the perspective of the external expert advisory board to this joint action. And I have to say that I have worked in many projects, but haven't had such a perfect, excellent advisory board from the expert role. Nathan Money is a lecturer in inequalities and global health policy at the University of Edinburgh, Global Health Policy Unit in the School of Social and Political Science. And his research focuses on the commercial determinants of health, seeking to describe the mechanisms through which commercial actors affect health inequalities, knowledge, and public discourse. He's also Commonwealth Fund Senior Harkes Fellow and the Deputy Director of the Local Health Global Profits Research Team in the UK Research and Innovation Population Health Improvement Network. So, Nathan, we are really looking forward to your reflection on what we are talking about, what we are trying to implement, because your board has given us the main advice: be bold in whatever you are doing. So the word is yours.
Thank you so much. Thank you, everyone. It's been a real privilege to listen and learn from the work that's been presented so far. So I just want to share some reflections from the perspective of the External Expert Advisory on the overall program on sustainability in particular, and then some closing reflections. Just before I do, to remind folks on the call of the role of the EAB, which is to strengthen the scientific quality of the work conducted, to contribute to optimal policy relevance, which is of course important to what we're talking about today and the notion of sustainability. And the board brings external expertise from a range of perspectives, including youth involvement, but there's clearly a lot of expertise on the call in that regard, law, architecture, urban design, commercial determinants of health, which is my own field of interest, as well as epidemiology and public health. To summarize some of the feedback from the initial work as presented at the EAB at our last in-person meeting, overall, I just want to stress that, as you mentioned at the outset, this is a hugely impressive and ambitious project, really unprecedented in its scale. In spite of that, the coordination, the management, the speed with which it has been initiated is very impressive. It's going, in the view of the board, extremely well. And the combination of these two things mean that this really represents a once-in-a-lifetime opportunity to meaningfully address the burden of NCDs in Europe. And it's the goal of the board to support this as strongly as possible. And that is reflected in some of the comments that you made, that the goal is to be ambitious and as bold as possible, considering these really unique confluence of factors and the scale and ambition of the project. So some of the reflections from the board in general that I think are relevant to what we're talking about today are, as they relate to sustainability, in terms of when you have a project operating at such scale in such a range of contexts, and you have so many activities, how do we integrate these as much as possible, right? How do we ensure we maximize the impact and the cumulative effect of these discrete activities, not just at the local level, but at the national and at the EU level? And as part of boldness, how do we ensure the greater emphasis on structural or upstream actions, right? So we often talk about prevention of NCDs, and we can mean that in a context of risk factor prevention, or we can think about shaping wider environmental factors and addressing the causes of inequalities and exposure to risk factors, right? And as part of that, the board wanted to sort of remind them to always be asking, right, what problems is it that we are really focusing on? So if we're interested in cancer prevention, what exposure is really focused on, and what are the causes of those exposures? What are the causes of those exposures? Because that will determine what our proposed actions are and the theory of change through which those actions will address the causes. And actually, that seems like quite an obvious question, but when we think about, as I'll discuss in a minute, some of the main challenges facing NCD prevalence in Europe, we have to think, particularly as we think in terms of the sustainability of our efforts, we have to think about sustainability in terms of moving upstream, right? Because the more downstream we move, the more we move towards further away from upstream prevention, and we move towards managing risk factors in vulnerable groups, then the more challenging it becomes in terms of sustainability, because we're in essence trying to stem a rising tide. And that will, as you've already discussed, include thinking through EU-level impacts and influence, as well as local and national level, and hopefully making connections with other EU programs to build energy and coherence, such as European Green Deal. And on sustainability in particular, some of the reflections from the EAB in the meeting in Menorca were around, and you've already done this, I think, really well in this webinar, is defining sustainability on your own terms as a concept with regards to the project. And I'm really excited to see that you're doing that. But it's okay, as you mentioned, to consider environmental sustainability as part of this, because there is a huge interest and crossover between planetary health implications, NCD prevention, and particularly when it comes to interest from youth. And in my own work, in talking to young people here in Scotland as part of work on NCD prevention, they really clearly see the links between how their environments are shaped and the sustainability, and also planetary health implications of some of those. And the point that was raised by the EAB, which I think is interesting about here, is how does this include novel dimensions of sustainability as well? For example, the youth work that's ongoing is incredibly important. How do we build longer-term sustainable ways of continuing to attract youth voices in the years to come? Because one of the challenges, of course, is the youth you speak to today will not be youth in 5 years, in 10 years. How do we ensure a constant pipeline of engagement? And to my mind, these boil down to much more fundamental questions, in my view, about what health actually is at core. Because many of our policymakers, we talk about sustainability from the policymaker perspective and the accountability cycle and the sort of knowledge gap. Many of our stakeholders are fundamentally concerned about healthcare and providing for an aging population and NCD prevalence in that context. But really, part of the reason for that is the wider environments in which we're living and the way those are changing. And so we need to think in terms of our ambition about broadening accountability to for those wider environments, those extreme drivers of NCD prevalence. And when we think about those drivers, some of the huge drivers of concern in our environments, when we think about drivers in terms of environmental degradation, externalities, when we think of drivers in terms of misinformation, right, and behavior change through social media, when we think of these drivers, we realize we really need to think ambitiously. We need to think upstream. When we think of actions, we need to think about actions that influence these wider environments. And when we think about the knowledge action gap in Europe, we have to think not just of us as researchers approaching policymakers in more ways, not just policymakers engaging more with the evidence. We also have to think about the other factors that shape the knowledge action gap, right? And that includes the aspects of the private sector and other stakeholders, right? When we think about challenges to amending pesticide regulation at the EU level in relation to cancer risk, for example, it is not simply a case of evidence and policymakers. There are other important stakeholders that shape these debates. And that's something that we want to think about in terms of sustainability, right? Not just individual regulations, but how do we shape regulation, the systems through which decisions are being made. And that's important because our environments are shaped in powerful ways. So just to take an example from near where I live here, if you look at the health inequalities in relation to NCDs, they cluster, right, among marginalized communities, deprived communities. For example, in Glasgow, when you outlet density, that too clusters. Alcohol outlets, tobacco outlets, takeaway outlets, these all cluster geographically. And so if we want to address these, we need to take this kind of holistic picture. And the same is true when we look at the distribution of outdoor advertising, right? These are inequitable impacts. And if we want to achieve action on NCDs, we need to consider the inequity of these impacts. As I said, the role of actors who may be in opposition to such efforts, right? So this is a leaked slide from Coca-Cola Europe, and it shows how they're mapping public policies in the European space. And depending on how they're likely to impact on business and likely to materialize, where they might fight on those or monitor or prepare. So just in closing, as we think about sustainability and some of these wider structural factors, it's important for us to think about being ambitious, thinking about what changes can be long-lasting and how we make changes upstream, and how that informs the theory of change you're talking about, including the policy landscape far beyond health, right? Because NCDs are shaped not just through health policy, but through a wide range of other sectors. So with that, I just want to thank you again for all the work you're doing on sustainability in regard to this work, for the fantastic presentation, and I wish you the best with your future efforts.
Thank you. Thank you so much, Nathan, for pulling it so nicely together and really guiding us into this structure agency dilemma. Maybe if we still see it, that the upstream definitely would be the right way if we want to get to the higher sustainability of our outcomes and recommended outcomes, I would say. So we are with the conclusions and final remarks. As we are not open to the public at this webinar, I would just like to ask you three, maybe if you might share, or maybe I have few issues while I was listening. Excellent presentations. So maybe, Gabriela, what would you say? What would be most difficult in the accountability in the literature we search for? Taking and sharing is obviously well known. We have a lot of published articles on that. Holding, responding is a bit more difficult. What do you think? Where is our biggest challenge here in using the accountability cycle?
Thanks, Monica. I like the question. Indeed, I think recently, particularly say with COVID, a lot has been done on trying to bridge this science to policy gap, particularly because say at that time there was a lot of science being produced very quickly. So I think you're correct when you say that this say sharing of the account, there's a bit more literature, a bit more evidence on it. I think perhaps why there may be less literature, say on the holding of the account, is also because I think it's quite difficult to study, because what we're asking is, are we being accountable to one another? And I think, like I said, with the definition of accountability, one another, who are these others? Who am I? Am I part of what groups? So already there, when you look at these variable about who to who, it's quite complex. And then more than that, and I think in this last presentation we touched on that, it's the context is complex. So the policy cycle I showed is one that's extremely simplified. And we know there's a lot of back and forth, there's a lot of changes, a lot of inputs from different elements of the context, which could be environmental, in the sense of the physical, be geopolitical. It can be in terms of different policy windows. It can be about different policy entrepreneurs linking things. And so you have a lot of moving parts. And so I think asking a question, has someone been held to account? And who is more complex? There have been some, and maybe I would direct any interested participants to work done by Mayhew and Van Bell in 2 words, because they looked at the health system level, and I think in Ghana it would be, but quite some years ago, on the interactions of accountability and what we could say about accountability in terms of that. Now, of course, that's in one country in a specific context on a specific policy. And when we look at the Joint Action Prevent, I think, as was said various times, it's massive. It's a lot of people, a lot of objectives. So looking, are we accountable on all these different policies, on all these different practices, not to mention at the EU, the national, and the local level. And I know in the group here, we've talked about that. How do we involve all these people as well in this work? So I think that will be part of the challenging part for the sustainability plan, to ensure we can make something that's both concise and actionable, but also encompassing this wide-reaching aspect.
Okay, very complex. That's what we can learn from that. Thank you so much for this additional intervention. Katja, we were just wondering here, what is the age that you can still consider yourself young? And the additional short question, how it's here now we are more perceived here in the traditional environment, how the youth are moving into digital environment, how they can help us with that in our sustainability approach?
Yeah, so depending on who you ask, the definition of who is considered young can be different. Even European countries actually cannot agree on that. So we have used kind of like an extended age model for the youth advisory group. So we considered the age group between 18 and 35, with the 30 to 35 being that extended age group, because the European Commission normally within Erasmus program actually considers 18 to 30 as the main youth age group. And then when it comes to the connection between the traditional and digital, I think obviously young people are a bit more open to trying out the digital solutions, so they come to them a little bit more naturally. And as I've in my past helped my mother and grandmother and so on figure out new phones and digital watches and stuff like that, I think that can also then be translated into other digital solutions and helping see what digital digital solutions and tools we can use with this project, or potentially even produce them in order to support the prevention of NCDs, so that it is, as a good response to the needs of young people, especially since we know that they use a lot of these digital tools.
Okay, thank you, Katja. So counting on you, on the youth group, really, in this respect. And Nathan, I'm just wondering, because you have so nicely highlighted the upstream approach, and I'm really more somehow enthusiastic about what we are trying to do with the sustainability, but at the same time, we have all those perma-crises, which are very complex, defining the upstream approach in a way, but at the same time you show us so nicely it's a health. How do we define health? So how to link health with this perma-crisis and still think about the sustainability for our actions, because we know that health promotion is teaching us health is produced out of health sector majority. So what would be your few minutes last answer here?
Yeah, so obviously I think that's the kind of the question. I think there's been some really interesting work around, so we're looking at, for example, the 3D Commission on Data Determinants and Decision Making, which tried to sort of expand breadth of data types used by decision makers in making decisions more broadly, right? And this feeds into kind of notions of health and all policies, but also notions of policy coherence, right? And the European Union is a place where there's lots of scope to improve policy coherence, right? So you have parts of the budget being spent on health promotion efforts to reduce harmful alcohol consumption. You have other parts of the EU budget being spent to support alcohol advertising as a sort of a key, a key economic driver. You could say the same about common agricultural policy. So I think you're right that these things are really complex, but ultimately, if we want to achieve policy coherence, right? And I think that is part of sustainability, is aligning activities in the economy and regulation, right, and in health. Then we need to do that. And I think the other good thing about taking that wider approach broadens the range of potential stakeholder organizations, right? So instead of talking about our stakeholders as simply being, for example, NCD charities in the context of NCD prevention, but all sustainability charities, also transparency charities, also human rights, also the rights of children, right? All these fact-checking charities, these all become relevant parts of our work. And that, I think, that is very, very exciting, even though, as you say, it becomes a complex field to navigate. Oh, I think you're on mute.
Thank you. Yes, thank you so much for this answer, and adding to the complexity, because we could not pretend that whatever we are doing, trying to be as bold as possible, that we will be able to do it in our small, minor worlds. We have to go upstream together and understand the complexity of the space we are living in. So we are quite well aware that we have stepped into quite a big shoes, but we would really like to use this opportunity. You have made it correctly, and we are very happy that advisory board is supportive here, that we can make change if we understand how to make this change. What is the environment in which we could produce the change, or we could initiate, or we could support, or we could foster the change? So hopefully, as we are still exploring how to approach, we are working with our colleagues, our partners in joint action in the other work packages, what to do, how to do so. Hopefully, with a common understanding, we will be able to come up with a good plan for recommending sustainable actions and to get attention of those who are making decisions at the end, because there is the power, and hopefully to recognize where the PowerPoint stands and where the pressures are coming from. So stay tuned for our monthly webinars. We hope that we will be able to present at other opportunity too, but next month our colleagues from other tasks will be with you. If you want to contact project coordinators, scientific coordinators, communications, please do it. If you want to search our website or follow LinkedIn, Facebook, YouTube, here are the links. Thank you for being with us today. Thanks again to the great speakers, and see you again. Bye.